Hello, friends, and welcome back to another episode of the Concussion Nerds podcast. And I'm really excited for you to meet our guest today because she is an expert in something that fascinates me that I would love to learn more about. So today we get the joy of welcoming Lisa Kramer. Lisa, welcome to the Nerds podcast.
Thanks so much. I am definitely a fellow concussion nerd, so I'm glad to be here.
I love it. So Lisa is a licensed professional counselor, also neurofeedback provider, and the owner of Mind Body Neurotherapy in Colorado, where she practices neurofeedback. And I'm super stoked because this is a modality, I would say, Lisa, that comes up a lot. And there's always lots of questions around it. And we've never had anyone on the podcast talk about neurofeedback yet in 102 episodes. So yay!
Yeah.
So I would love to start with you actually just introducing yourself a little bit more, who you are, what led you to where you are today, so our audience can connect a bit more.
Happy to. So like Natasha said, I'm Lisa Kramer, and I am a licensed professional counselor in both Illinois and Colorado, outside Chicago and outside Denver. And I own a practice in each. Mind Body Neuro will get you to me, either or Mind Body Neuro of Illinois or Mind Body Neuro of Colorado, all of the above. And we're primarily a mental health practice, both of them. But I have a passion for concussion work. You know, I was a college athlete. I have two children that were college athletes, and concussion is no stranger to us. So it's really turned me on when I learned about neurofeedback because it helps with many things. But what it really is awesome at is helping people through the late stages of symptoms with concussion, the ones that are lingering, and post-concussion syndrome, which is even later, right? But it really is remarkable because it can address multiple areas, and we'll get into all that. But so, yeah, I mean, I'm in practice. We have a fabulous staff in both cities, and I really am a dork about all this stuff. So I love questions, so anybody can reach out. So
amazing. So let's start with like the fundamental question here. What is neurofeedback?
Okay, great. So neurofeedback it's a method of using technology to retrain brainwaves that are dysfunctional. So that's a pretty broad statement. Neurofeedback helps with symptoms, right? Brain waves are kind of divided into buckets by speed. And that's how everybody in neurology kind of all over the world can identify what brainwave is happening in an EEG, which is your electroencephalogram. That's your brain rhythms. Like an EKG is your heart rhythms. Most people know what an EKG is.
Yeah.
So we start everyone with a recording of that EEG, their specific brain, what's happening up there. And that recording is non-invasive. It's just a silly cap gets put on your head and there's some gel in there. So your hair gets goopy, but no stimulation or electricity or anything's going into your head. It's just measuring. And we take that and we look at it for what's happening in your specific brain. And we're looking at patterns of what brainwaves are prominent. Where are they showing up? Are some swamping all the others? Or are they deficient where we need them more, like your thinking waves? I'm looking at levels. I'm also looking at networks, and are they communicating well, or are they not talking? It shows us other things like, are there indications of ischemia, which means there's reduced blood flow? We see that quite often with head injury. It can show us, is there epileptiform, which is not necessarily mean seizure, but subclinical seizure maybe, or maybe full seizure. So we start there. And then the neurofeedback is the training of the brainwaves. And there's lots of types, but the traditional approach, which a lot of people use, is where you watch a show or listen to something, and you have maybe 3 to 5 sensors on your head in an area that we're trying to influence. And if your brain is going in the direction we want, so for example, if you have a lot of anxiety, that's an over-arousal, and we want certain brainwaves to be less powerful because they're keeping you amped up. So we want those brainwaves to be less powerful. So if the brain does that, the screen stays bright and clear, and the sound is crisp. And if the brain goes back to the patterns that are causing trouble, which it will in the beginning, the screen looks like it gets dark, or this video doesn't stream smoothly, or the sound gets quiet. There's lots of settings we can choose from. So it's positive reinforcement when the brain tries a bunch of things, and it's the brain. It's not you consciously choosing. The brain wants to see that screen again or listen to what it was listening to. And so it will try all sorts of permutations of brainwaves to see, how do I get that screen to come back? I want to watch what I was watching. And so that bright screen that comes back is the positive reinforcement. And so over time, it shapes the behavior of the brain. And the brain learns really quickly, how do I keep that the screen bright? How do I stay with my show or whatever I'm listening to? And so it starts to build a skill of doing this. So over time, it shows up sooner and sooner in a session. And then, so many sessions in, typically 5, 6, 7, 8 sessions, people are starting to notice subtle changes in their regular life, like out in their regular, day, or their partners are noticing changes, or a parent. And then our goal is, okay, we know we're on the right track. We want to make those changes more robust and consistent and noticeable. And then when they're starting to hold, we get to a point where maybe we wean off and we go a little further apart in the sessions until they hold on their own, and then they're done. So it's kind of a learning paradigm. It's simple, right? It's in the sense of it's just reinforcing what we're after. And then the brain holds those changes because it's more efficient. It's functioning better. You feel better. You're a whole system, right? Like head to toe. You guys talk about this all the time, right? So yeah, it's been amazing. And it's really a cool process to watch, especially because people come in because they've been struggling so long and they've tried lots of stuff. So that's neurofeedback.
I have so many questions and I have to remember them all so I don't send them out to lunch in my brain. Okay. Question number 1. Obviously, you talked about it being very beneficial for people with persistent post-concussion symptoms. There's a slew of multiple symptoms. So in my past experience, I've always heard, and we'll see if you correct me there, you're like, that's wrong. I've always heard that neurofeedback is most beneficial for individuals with ADHD, anxiety, or depression. Would that be accurate? Would you say yes, but no? What would you say to that?
I would say it's certainly helpful for those conditions.
Yeah.
We do a lot of work with that, but it's definitely helpful with concussion as well. I tend to talk with concussion clinics that are PTs and OTs and functional med, and they're helping with the injury piece, the tissue repair, and all the other parts, maybe balance and vestibular stuff, vision therapy. That's all, they do such awesome work with that stuff. But there's mental health pieces that very often show up because of the concussion. And I think that's a piece that people don't connect as much.
Especially if it's the predominant symptom, it gets missed all the time.
Yeah. So my depression or my mood swings, they don't even clue in that, oh, wait, that started or got worse after I had that head injury. So I kind of divide them into buckets. The first one, thinking issues. So cognition.
Okay.
Brain fog, memory trouble. Those are 2 big complaints, and those respond wonderfully.
Okay.
Then there's mood trouble. So anxiety, depression, mood swings, even personality change in severe cases where, we've heard from the spouses, he's not the same person. Yeah. And those things are hard, right? And the person, that can be, your defenses just flare. What do you mean I'm not the same person? That's really frustrating. So they don't connect that to the head injury necessarily. But those 2, and then sleep is huge. Okay. And that affects everything, as we all know what good or bad sleep does for you. And I have yet, and I should have started keeping stats, but I've yet to work with a concussion person that doesn't have messed up sleep. It's almost ubiquitous with the condition. And that is one of the first things that starts to change. So that's really cool. And we track it. We often ask for people to track it. So there's an objective, hey, this is what it said, how many minutes I got of deep sleep and how many minutes I got of REM sleep. And they're like, I got 19 minutes. I'm like, you better work on that. So it's,
Okay.
so the mental health piece. And if you don't feel good and you're struggling with moods, you're not going to go to your PT. You don't do your exercises at home, or you can't remember what you're supposed to do, right? So it all works together.
Amazing. So that's very helpful. In terms of, we talked about like there's different types of neurofeedback, right? When I start Googling neurofeedback, and I've gotten this question more than once, and so I would love to your take on this. Like, so when we look at like traditional neurofeedback versus like Loretta versus the lens system versus, especially because lens is showing up more, and lens is marketed as quicker progress. That's its marketing ploy. Less sessions, less money, quicker progress. Right? So when they're looking at these different systems, dry cap versus wet cap versus like all these things.
You did your homework. Good job.
I've done some neurofeedback courses. So when I thought I wanted to do it, and then I was like, I don't have the time to do this myself in my clinic. So when we're looking at these different types and people are trying to figure out what type of neurofeedback do I want to do, what would you offer in terms of guidance? Because it is turning into this place of, on the island where I live, you don't have a ton of choice. But like if you go to a major city, it's like you have one person that's doing lens and one person is saying you need 30 sessions, but the other clinic is saying we need 6 to 10. Like how?
Yeah, it's confusing, right?
Yeah. So what would you say to someone who's in this confusion rabbit hole?
I would say there's a lot of systems and a lot of them have their own validity and they work well. The bigger guide for me is if you're going to be treating your brain, have someone who's going to do an EEG first and not just dive in without looking.
Are there some of them that don't do a QEEG
Well, sure. Yes, there are. So QEEG guided neurofeedback could be a lot of different types of systems. Loretta,
Right.
There's all kinds of BrainMaster, BioTrace. There's tons of systems out there. And for slow and for low, like there's tons. Lens is microcurrent. So it is slightly different in that it's actually feeding a tiny bit of current into you after it reads your dominant frequency. So its feedback of lens is a current. And it's very short. You start with like 2 or 4 seconds on a set of sites. And I actually utilize lens in certain cases. But I still, the way I've moved through this field and my own study and the board certification, all the requirements have really led me to believe you need that image. You need that person's EEG data to really know which direction to go safely. And when I do that, and when I started employing that all the time, our outcomes really skyrocketed. So backing up a little bit, look for someone who's utilizing the EEG first to guide them.
You know what's so funny is like I'm hearing you say that and I'm like, well, doesn't everybody?
No.
Like, that is literally like, I would never do it. I would never, even if I was trained, like I would never do it without having that information first. So it boggles my brain that people are doing.
I will say
having it.
Yeah, and there's a lot of people who have very successful practices. Do they do concussion? I don't know, right? Like, but there are types out there that they don't do that. They just work on something until they get the response thereafter. So there might be some like trial
like an
period.
Exploratory.
Yeah, and then when they kind of dial in this is what's working, then they go, in that direction.
Okay.
I'm not going to say that's not legitimate. It's, probably super valid, but there's board certifications and those require quite a bit of rigor. So you can look up people on those sites and I can offer those sites, So yeah, that's what I would say. Find somebody who's going to look at your brain first.
When someone does, so just because I get asked about lens versus, and the reason I get asked about it is because it's a shorter session period for most people. Or so it says. And you utilize it, you said, with certain people too. So just as a provider who uses the lens system, does that system generally also have an EEG that would precede treatment? Or is that an example that usually it's more of that like
lens does not approach? They have their own method of mapping. It's not an EEG where you are measuring the whole head at once. Okay. Kind of a thing. All the sites that we all agree on are kind of the nomenclature and the map that neurology approves of. Lens has a different method of guiding their treatment. Lens can be amazing. I'm not going to lie. Like, I think there's times when it's awesome, but it also has to be the right fit for the right person. And you are, even when I use lens, I'm using the EEG first.
As your guide.
Mm-hmm.
Yeah. I do love that. And it's like, it fits in really well with just like like this whole, like the way I practice and like the whole thing on the podcast is like, I'm not a fan of throwing spaghetti against a wall and seeing what sticks, as I call it. Like, that's not the way I like to practice. I like, as best as I can, having an objective outcome measure, an objective process that then guides me to specificity for that individual person. Because I think too often what happens just in all of our fields is that we don't have a process, or we do the best that we can. But then when we get stuck, for example, then like, it just becomes, okay, I'm just going to try this and see. And if this works, we'll keep going. And like you said before, it's not like that. That's not always a bad thing. But if we have that ability to be like, I'm going to do this thing, it's going to tell me this, then we're going to treat based on this, and then we're going to reassess this and see if we're making progress. Like it just, well, it's the process. Like, I'm biased in that.
Yeah. And I'm a data girl. So I'm like, I want to see and make it fit for that person. I don't want a cookie cutter plan.
Right.
Because what do concussions are like?
Right. None.
They're none. Right. So, yeah.
And we have that big discussion too. And we just launched our roundtable, which is our YouTube show this week as well. And we had this big discussion on the YouTube show as well of no two concussions are the same. And part of the impact of that concussion is based on the person coming into the concussion. So who you were at that time of injury will impact the outcome of that injury.
100%.
And so, like, while no two concussions are the same, no two people are the same that are experiencing a concussion. And I think it's why we can always have that incidence of like, you could have been in the same damn car, looking the same direction, been hit from this directly the same, and you're going to present completely differently because no two concussion is the same and no two people are the same going into it.
Absolutely. So, yeah. And even can go through the same treatment and have different outcomes, right?
Oh, absolutely.
One could be like, I feel great. I've done this, really helped me.
Yeah.
You see the Reddit, concussion threads, and they're like, go to this one and do this program and do this. And they're like, I tried that, I didn't get anywhere, but nutrient load, there's so much to it.
I always say like, there used to be nothing like that people like would Google. And now it's almost the opposite issue is you Google, what can I do to treat my concussion? And you are swarmed with like everything.
It's too much. Yeah.
Yeah. So you get your QEG or your EEG, you've specified like your treatment, whether you're like increasing alpha or gamma or whatever brainwave you're retraining. Do you ever complement, like if someone has a home program with, so like my photobiomodulation device, for example, I can entrain with alpha or gamma or beta or whatever I want. Do you ever layer the two modalities, for example?
Absolutely.
Oh, please.
So photobiomodulation, like the infrared light therapy, is a big piece. And we're really careful and gentle to build it up slowly because you're going to increase blood flow. So it depends on the damage piece, right? And what the metabolism in that person's brain can handle. So we have to be very careful, but huge help. And I feel like it can even kind of prime the brain before. So we start with that. Maybe we start with 2 minutes, then build slowly. As long as they're tolerating it, we can build time on and then do the neurofeedback. We also have other types of neurofeedback. There's neurostimulation where it's more than the microcurrent of lens and more of an interactive feedback kind of device or systems like that. And for slow, like there's other ways to do that. And I really like to work collaboratively. So if they have a PT or they have even an MD that's, working with them to try to manage things. So we're talking about medications. We're talking about physical exertion and what is their return to movement schedule. So we're aware of that. And then we have partners with functional med. So we can bring that piece in if that's needed. Dr. Michael Pierce works with us and he's fabulous and he's a genius, I think. He probably shoot me for saying that, but we love him. And he is super helpful with the really tough cases that have a lot going on. So yeah, it's a multimodal, I think is partly why we get the success we have. Yeah.
That's amazing. Yeah. So we use photobiomodulation in the clinic and we very much use it as like, I would say normally we use it as a primer, like same thing. So like we use it as like a priming the system to increase some of the blood flow to the brain so that we can then challenge the brain is kind of how we use it. However, sometimes it's the piece of we'll use it at the end of the session because it like helps people calm down if they want to. And then we have some clients who just the positive effects they get from the photobiomodulation in itself, they'll come in and do just photobiomodulation sessions in between. So
yeah, the research on that is astounding. Like, it's so powerful. So yeah, it's really good.
Yeah. So when we were chatting before too, so I always feel like no two providers are the same. If someone comes and works with you at your clinic, what does that process look like?
Sure. So the consultation is always the first start, right? And we want to talk with you. It can be Zoom. We do have, so we're both, like I said, we're both in Illinois and in Colorado, but we do intensives. So we've had people come from other areas in the country where they come in, we do an EEG and we do like a rapid processing of it. Like we push it to the head of the stack, so to speak. And then over 2 weeks, depending on how they can tolerate, they can do up to 2 sessions a day. So we can sometimes get in like 20 sessions in 2 weeks. But we start with a consultation to hear, where are you in your journey? What have you tried? What's still, the reason you're reaching out, the struggle you've got. And then try to talk about, are you open to looping in your other providers? And then I explain, neuro even more in depth. I have a whiteboard that I'm scribbling on all the time.
Love it.
And then get the EEG. That's first step. And then I analyze it, and that takes a little, a week, 10 days, sometimes 2 weeks, and come up with the QEEG, which is the brain map. That's their report.
Okay.
And then we come back together with that and say, this is what I found. It usually unearths a whole bunch of more questions, and then we say, okay, what are your goals? What is the most important piece for you first? And we make a plan based on that. And then neurofeedback can look like, if you're in the area, it can look like twice a week. 3 times is kind of sweet spot, but most people just can't with their schedules.
Right.
I get it. And you get perfectly good results with twice a week. And then we're tracking. So they're doing those sessions twice a week. We're tracking amplitudes and things in each session. We're tracking their subjective, like, what's going on? How have you been doing? What's not working? Tell me what's going on, to try to really dial in on the direction we want to go. So maybe we're adding another modality because we're not getting traction. We're rescaling symptoms along the way, and then we're graphing changes of amplitude and brain activity, usually around 20 sessions. And everybody's different. The EEG gives us somewhat of a feel for how many sessions, but it depends how severe and how long they've been struggling. So someone who comes to me and had a concussion in a bad car accident 20 years ago, those patterns are pretty firm. So it takes time. They might take 60 sessions.
Right.
But someone who just had it, but we're 3 months out and they just can't get the head pain to go away, they're going to respond sooner because it's not as deeply wired. So that's what it looks like.
That's cool. What would be your ideal, time frame to see someone after a concussion? Would be first part of my question. And then is there a certain type of treatment or something you want them to have tried first before neurofeedback, or that part doesn't matter? But what would be that, this would be the ideal pathway that a client came to us. What would that look like, just out of curiosity?
Yeah, I would say, the number one thing we have to be sure of is there's no bleed, right? Especially if we're going to do any current or stimulation or anything like that, or even the photobiomodulation, because we don't want to increase blood flow if there's a bleed, or that's dangerous. So we want a clear CT, CAT scan. I usually say, give yourself 4 weeks. I have some supplements I usually recommend, that I think, have been researched and they are helpful, but I don't typically start because most people will heal pretty well on their own with good nutrients and a good return to motion, not just go lay in a dark room anymore. That's defunct, right? So if you're still having consistent level of symptoms at 4, 6, 8 weeks, then we could step in, right?
Okay.
If you have 2 years of it, just come in, right? Because those things, the despair, like that feeling of this is never going to get better, that is so hard for people, is heartbreaking because we can help. Yeah. And I want people to know that, right? So that's the ideal timeline. But I wouldn't say don't come in a week later, right? Your EEG is not going to be really accurate anyway, because you're going to have a ton of inflammation.
Right.
And it's not the day 2 and 3 and 4 days. Then it starts that cascade, that as your brain tries to heal, and if there's been shearing or all these other pieces from the injury, that inflammation starts up from there. So the EEG is not going to be very accurate in the very acute stage of a week or two right then. So that was your first question. What was the second part?
That basically answered it too. It's that that timeline of that 4 to 8 weeks versus, from a PT perspective, I want you in front of me on day 3.
Yeah.
Right?
And because you can do things then.
Yeah. And that's just it. Like, absolutely. Yeah. And it just speaks to, again, how you can have a collaborative picture. Like you talked about, like you love to work collaboratively. And so it speaks to, as a PT, being like, okay, like if we're starting to feel like we're not making the progress we want to make, like maybe we refer to neurofeedback and that gets layered in, but we're not going to refer out before 6 to 8 weeks. And like from the timeline perspective, that is helpful because it's like, okay, when is the appropriate referral? All right, here we go. And I definitely know and have clients where I would say where I am on the island, there's not a ton of neurofeedback options, which is why I considered doing it and started that process. And then I was like, this is not happening.
It's a lot. It's awesome. But it does take a lot of time.
I was like, I can't remember. I did one like weekend course, like an intro course. And I can't even remember, I can't remember who I did it through. And it was fast. Like I was fascinated. And I sat back and I was like, I have no fucking time to do this.
Yeah, I think, if you had someone who worked with you that could pick it up, right?
Well, I have an entire team, but then I'm like, then I'd have to train someone that like, this was their job. And we do. And then it comes back to the piece of like, you know what? We're really good at what we do. We don't need to be really amazing at everything. Mm-hmm. And so there's a couple of clinics on the island that we can refer to for neurofeedback. And I'm like, you know what? That's good.
Yeah. No, and then they will need you too, right? Like that's what I love about, I just called a place because I've got a relationship with one and I'm like, what's the HBOT contraindications? Like I know there are some, but I need to know because I have a client asking and I want him to go where someone I know, not just one of those like HBOT spas.
Yeah.
Where you sign a waiver and you have no idea. And thank heavens I called.
Be careful in this day and age too, a little bit too, is because so many of products that we can use, there's a wellness version of them. And I didn't realize HBOT spas existed, but like, wow. But it's like, there's still a risk. And
well, and seizure, right, is a contraindication, seizure disorder, or lung issues, collapsed lungs, or sinus issues. We talked for, a good 15 minutes yesterday. I'm like, what? Go over it with me. And I was so glad I called. So those kinds of relationships are important.
Yeah. And I think too, it's this piece of forming, and I think we talk about it all the time, but like forming those relationships within our communities to have that collaboration. So we just provide better care for our clients in the outcome than trying to be like the one place that does everything. Like you can do a lot, but it's still like and I always say as therapists, we have to recognize where our ceiling is and recognizing where they would benefit from something, another service. And then we can help facilitate that referral process to build that. And I think that's so important in the concussion space and health space in general, but.
Yeah. Well, and I think you're always going to run into practitioners who think they can fix anything.
Oh gosh, yes.
But jack of all trades, master of none kind of thing. So yeah.
Lisa, thank you so much for being here. And when we first connected, I was like, it was that realization, I'm like, we haven't talked about neurofeedback at all on the podcast. So I'm stoked because it is a modality that, like I said at the beginning, absolutely intrigues me. I've definitely had clients who've had great success with it as part of their like repertoire in their like process. Yeah. Do you have any final words, thoughts, things you want to share with anyone who's listening?
Yeah. I guess my main thing is know it's an option, right? And you can find practitioners. Maybe we can link these, but there's like a bcia.org is the board certification for neurofeedback, biofeedback, RHRV, and they have directories of practitioners. So you can put in a zip code or whatever, and find who's nearby you that's certified. And then there's another one for EEG certification. So I'll send you those and maybe we can stick those in there.
We'll drop those in the notes below.
Yeah. And I think especially if you're a parent of a kiddo that has had a head injury and you're noticing they're not back to themselves, reach out, right, to somebody. I'm always happy to answer questions and help find resources. But, we're all terrified of the CTE stuff in the world. And you can, I believe, do a lot to correct, and don't just wait. That's my biggest
I agree with
thing.
that 100%.
There was I just got an article. It was published 2 days ago in Neuroscience News about they're finding new ways with MRI to detect possible biomarkers that would turn into CTE.
Okay.
Because you can't currently diagnose it until postmortem. But
yeah.
And so I just think, man, just don't wait. You can get that brain back on track with a good practitioner. It's awesome. So yeah.
No, I agree with
thanks so
that
much.
statement. Absolutely, fully. It's like we don't need to live in fear of it when we can take proactive measures to help our brain health and our health in general. So I wholeheartedly agree with that. Thank you so much for being here. We will share your website, your contact info, all the things below in the show notes. So if anyone wants to reach out to Lisa, please do. Again, she does intensives for neurofeedback in the Colorado location, right?
Yeah, mostly there because we can have the staff and scheduling that it can work here. Yeah.
Yeah. So
I am open to an idea in Illinois, but better Colorado. Yeah. Plus it's prettier here.
Fair. I've never been. I've been to Chicago. I've never been to Colorado. Reach out if you have any questions about neurofeedback or her practice or working with her. And until next time, my friends, we will see you soon. That's today's episode. Thank you so much for tuning in. If you liked what you heard, give us a like, give us a share, give us a tag on Instagram, and please never hesitate to reach out. We love communicating and connecting with you. Until next week, my friends, have a marvelous day.